Good evening, and welcome to Your Idaho, where we discuss issues facing our state and its citizens. This program is brought to you by the GemStatePatriot.com, an Idaho-based electronic newsletter. My name is Bob Neugebauer, publisher of the Gem State Patriot, and to my left is Steve Ackerman, our managing editor. We have several subjects we'd like to talk about tonight, and we hope we will not only enlighten but inform you on topical issues being discussed throughout our state. Our first topic tonight will be the State Healthcare Exchange, or as some of you might know it, Your Health Idaho. Steve's an expert in this area, having done extensive research and has been involved with this issue for the past year and a half. So without further ado, let's begin with some frequently asked questions about Your Health Idaho. So Steve, am I required to use the State Healthcare Exchange?
You're not required. It's a voluntary program. This is one of, if you will, one of the problems that we saw, and that is that the State Health Exchange bill, the legislation, was sold as something that we have to do, or else the federal government would be implementing a health exchange, and yet they made it voluntary.
So when we talk about a State Health Care Exchange, what does it do for us that a federal exchange wouldn't do for us?
So the big argument that they'll make is that if you use the State Health Exchange, you will get tax subsidies. You'll basically get credits to cover part of the premium. And you and I have done, and we've talked about quite a bit, some of the research around where the premiums are going with Obamacare. We made the comment a couple times when we went through looking at how the IRS is estimating, what, $16,000 a year as an average for a premium, which is working out to about $1,700 a month. And so one of the things they're trying to forestall, right, they're trying to prevent, is those premiums from going up. And so only through a health exchange, a state health exchange, can that occur. But with those credits come other costs, and come federal ties and federal rules that come into Idaho, essentially bringing the Affordable Care Act, bringing in Obamacare.
So I understand that with this State Healthcare Exchange, we also have to enforce the rules.
Right.
And does that also include the IRS rules in picking up penalties for all those who don't abide by the rules of the exchange?
It does, and that was actually not only one of the controversial parts of this bill, but it's something still in court. And that is, the argument is very simple. You have two types of exchanges. You have a state exchange and a federal exchange. And according to the law, the Affordable Care Act, according to Obamacare, only a state exchange can bring in the IRS and the IRS's enforcement authority. Because again, with the tax credits come the tax penalties. And one of the problems, or at least what we're seeing now, is states like Oklahoma are fighting that. This is why a lot of states have said no to a state exchange, because they know that the IRS's tax regime is going to come into play, enforcing.
So there really was no benefit, as far as the IRS is concerned, in terms of making a state healthcare exchange available here in Idaho. Am I correct?
That is correct. We would have been smarter not to go with the state exchange, if for no other reason, because we would have avoided bringing the IRS into Idaho.
So with the state exchange and with this penalty from the IRS, this is supposed to help subsidize what you would call subsidies for those who sign up on the exchange.
Yes.
And are entitled to them because they have low income?
Yes.
How is that going to work?
So what's going to happen is, if you're at 138% to 400% of the federal poverty level, which ranges between individual and family, but essentially 138% to 400% of the federal poverty level, then you're going to get some kind of a subsidy. If you're above 400% of the poverty level, you're going to get hit with the new tax. If your insurance plan is considered Cadillac, too expensive, that's going to get hit with a 40% excise tax. And if you're below 138%, you're going to get shifted to Medicaid automatically.
So we're talking about people that are in the range of $15,000 to $44,000 for an individual and $31,000 to $92,000 for a family of four.
Yes.
Okay. So this is a pretty wide range. But
it is.
From what we've heard of lately, not an awful lot of people are winding up with these subsidies.
That's right. But we are hearing that some of these people are winding up with up to $10,000 for a deductible, $10,000 a year.
And that's something that I don't think anybody expected. The deductibles have really increased for most of the people
Yes.
I've talked to.
Yes, they have. In fact, nationwide, people have seen twice as many people, get this statistic right, twice as many people have seen their deductible double.
Well, with a doubling of the deductible, plus what I'm hearing about the premiums going up,
Right.
some as much as 25 and 40%.
Yes.
So where is this $2,500 that we were going to save with this Obamacare?
Right, that's a good question. And the bottom line is insurance companies are doing what any company would do that has a set of rules imposed upon them. And that is if you're offering a product and you're told the product must now have various rules and things included in the product, such as whether you're male or female, you must have maternity care. Whether you're male or female, you must have prostate care. And various things that are added on. Anytime you add something to a product, any product, you're going to increase its cost. So what does an insurance company do? It raises the deductible and it increases the premium going back to your 25 to 40%.
So as I understand it, I'm going to be covered for maternity care,
Yes.
even though I'm not going to have a baby anytime soon.
Right.
And my wife is covered for prostate care. Is that correct?
That's exactly right.
That makes a lot of sense.
That's right. And you're also covered for mental health, behavioral health, whether you need it or not. By the way, children's dental, all adults will have to cover children's dental. So there are a number of things that come into play here. And of course, all of these things are simply going to raise the cost. And what does an insurance company do? It increases the deductible, forcing the individual or the family to have to bear the cost, and increases the premium.
So my next question is, they have to get so many people to sign up, and as insurance companies put these people together, they're going to have so many from the younger group, so many from an older group. Now what happens if there's a mismatch in these pools? Who's going to make up the difference of the cost of that?
You know, that's a great question. I hate to say that it is a question that Congress, nor it appears our state legislature explored when they were looking at H.248 and passing the state exchange bill, but that is a problem. The only place I can see the money coming from is this user fee, which means anybody using the exchange is going to have to pay a user fee in order to avail of it.
So let's get back to that user fee. As I understand the user fee, this is supposed to be as the same as kind of a premium for having the healthcare exchange and be able to buy insurance on it. Is that right?
Yes.
So that will depend, the user fee will depend on how many people actually sign up for the insurance.
That's right.
And that's going to be based for their budget for the year, which I understand they have to be solvent and running by themselves by 2015.
Yeah, and that's according to the Affordable Care Act.
So what happens if they don't get enough people to sign up?
Well, I think that's why they went from a fixed dollar amount, charging a fixed dollar amount for the user fee, to charging a % of the premium wherever that premium goes. So go back to your point about the premium going up by 25 to 40%. Right now, they're going to charge 1.5% of the premium. Now, if that premium goes up by 40%, it's 1.5% of a much higher number, right? And if that premium continues to go up and there is no cap on that premium, wherever that premium can go, then the user fee is going to take 1.5% of an ever bigger number.
And so what happens here is that we wind up with a higher rate than we would have wound up on the federal exchange if they don't get enough people to sign up. That's where we could be.
Yes.
That doesn't sound like a very good idea.
No, it's a problem. It brings a lot of costs, and you know, how prepared are families to deal with this? How prepared are individuals to deal with this? And how prepared are small employers? And you cited a statistic of small businesses, right? What is it? It's more than half.
70%.
70%. So how well are they prepared to deal with this?
Well, I'm sure the small businesses are kind of happy. They've got a little bit of a reprieve here for the next year or so. But, you know, I do believe that there are reasons that they're doing that. Number one,
Right.
they can't quite get this whole thing together. First, they got to get the website to work. But let me ask you another question. I understand that all the information that goes into the computer in the healthcare exchange, the way they had set it up with the bill that they passed in our House and Senate, that information is supposed to stay in the state.
Yes.
But I understand that we have a federal computer that goes right into federal databanks.
Yes.
So how do we keep control of that information?
Another good question, and I don't have a good answer. The best I can say is the software on which a person will enroll for an insurance product is federal. And this is why, if you look at Your Health Idaho, even look at their press releases, what you see is the numbers they report are the numbers that come from Health and Human Services. They're not reporting any numbers. In fact, I don't believe that Your Health Idaho really has any idea how many people actually selected a marketplace plan and actually enrolled, because that software is federal software. There's no Idaho room that they're going through. So it's directly on federal software, and then when HHS is prepared to release those numbers, they release it to Idaho, along with several other states that went with the state exchange.
So what you're telling me is that we got a grant from the federal government for $20 million
Yes.
to build an exchange.
Yes.
We still don't have an exchange, but we're still spending the money.
Correct. What we have is we have state folks are operating it, but it's on federal software, and all of the plans sold on it have to meet federal rules. You cannot sell a plan on the state exchange unless it fits federal rules.
So where are we going to get the money to build this state exchange if we're using this $20 million up pretty quickly, from what I understand? What are they going to do? Have to go look for more money? Because I understand it can't spend any state money.
Right, right. And that is something they had in the law, that it cannot use state money. So what they're doing, they're doing two things. The first is they're going to try to build all of the other things besides the software with the $20 million. But as we've talked about, and some viewers may or may not know, that original estimate of $20 million has now gone to $70 million.
Right.
So they're currently going after an additional $50 million in federal grants. And so the cost estimate's gone from $20 million to $70 million. So that's going to pay for salaries, that's paying for all the operations. The software is a combination of, some of it is stimulus money, federal. Other is some health IT money that was back in the early 2000s, 2002, 2004. That's federal money. It's largely federal money.
So let's see. They told us our rates were going down. They've been going up.
Right.
They told us we'd have better insurance. That doesn't seem to be working too well because it's higher deductibles.
Right.
They told us the healthcare exchange would cost us 20 or 30 million, and now we're talking 70 million.
Yes.
And they told us we'd be paying a premium of 1.5%, and now we're looking at possibly 2.6% or higher.
Yeah, it's possible that it goes 2.6%. What they told us actually was that it would be $4.80 per member per month. In fact, that comes directly from not only several members of the legislature, but also the governor's office. They said a fixed dollar amount, and that's the advantage, because they said that the advantage of a state exchange over a federal exchange is that we would have a fixed dollar amount. The federal government charges 8% of the premium. But that's now what we're doing. We're now doing 1% of the premium. We're charging the way the feds charge.
So basically, almost everything they've told us has been untrue.
Yes.
Including the fact that our information is secure within a state exchange because it's all been going into the Fed data bank.
Yes. The only thing they've done, and I guess I'll call it a saving grace, is that they have tried to make sure that the federal offices that receive Idaho's data, the data on Idahoans, and this is personal financial and health information. I mean, this is information that is clearly required by, has to be under HIPAA compliance. This is personal private data. What they've done is they've gotten a certification from the different federal agencies that they will be secure with that data. The problem is, once that data goes to HHS, it obviously has to go to IRS. It has to go to Homeland Security for immigration confirmation purposes. And it also has to go to the Department of Labor. So it is being shared among different federal agencies. I don't know where else it goes, but I know it goes to those 5.
Well, I presume that it would probably go to the NSA also, since they know everything that's going on.
May very well go to NSA. Yes.
Okay, I don't understand what's going on here with this this healthcare system. So basically, we have a healthcare system that says it's Your Health Idaho, but it's a federal exchange, and the Fed set the rules, and we don't have an awful lot to say about it.
We really don't, you know, I would even argue, you know, one of the points that was made of getting this off the ground by January 1st was that we had these mandates, and as you alluded to a few minutes ago, these mandates for both small business and now individuals have been pushed back by a year, and I understand that this, and I'll call it this magic wand, that the president is able to waive and change dates arbitrarily has now gone back a second year.
Well, that's another good question. If this was legislation that was passed by the House and the Senate,
yes,
how can the president change that legislation without going back through the House and the Senate?
Technically, he cannot. No president can.
Well, I don't understand why somebody isn't saying something about this.
I mean, we have an amendment process of, you know, we amend legislation all the time. A perfect example is the Affordable Care Act. When the Affordable Care Act went through, there was a rule in that law that said if any individual or business does at least $600 with another individual or business, then both had to complete 1099s. And they simply passed an amendment and said, let's cut that out of the Affordable Care Act and toss it aside. The Senate has voted 79-20 to get rid of the medical device tax. There's a 2.3% special tax on medical devices. That's been voted away. It's got to get picked up by the House and get voted on. But federal laws are amended all the time. As we all know, this is not an unusual process.
Yeah, I understand that, and that happened, of course, when Medicare came in back in the 1960s.
That's right. That's right.
But we're seeing an awful lot of changes from a bill that was put through and was supposed to be the best thing since sliced bread.
Yes, yes. And their best argument is really a very weak one, and that is that if you get all of these extra mandated coverage, in other words, if we add all these extra things on that you must have, that somehow that's better insurance. But I would challenge that. I would say, you know, a maternity coverage for a male doesn't make it better insurance. What makes it better insurance is that that male or female or what have you, that family can decide what they need for their particular situation.
Well, let me touch on one more thing. We've got some numbers today on the federal sign-ups. And the actual number that I'm hearing, the feds are saying it's 3 million, all right, a little over 3 million.
Okay.
But we're hearing that the real numbers are about 1.8 million if you don't include those who had lost their insurance and had to re-sign up again.
Yeah, that's another problem. And to be honest with you, that's a great question to ask here. Because Your Health Idaho, right, HHS told us that our current number of 38,000 enrollments is something, you know, to be bragged about. But there are several questions there. Number one, we don't know how many of those people who selected a plan actually paid. That's number one. Number two, we go to your point. How many of the 38,000 that did enroll, how many had previously lost their insurance? How many never had insurance in the first place?
See, and I guess that's the key. If we're not signing up people who never had insurance, and we're signing up just those that had it before,
right?
What was the purpose of this?
That's a great question. That is a great question. I'll add to the mix. 28% of those who are signing up automatically go to Medicaid.
And that's going to expand our Medicaid rolls very, very, very largely.
It's going to expand our Medicaid rolls, but it also goes to your point about those who may have had insurance before. How many of those people were on Medicaid and are showing up to the exchange under the belief that, well, I have to get a new policy because I've been told that these are all new policies under new federal rules starting January 1st. So I'm current Medicaid, and I show up to the exchange, I go through the process, they send me to health and welfare. I was Medicaid to begin with. I had public insurance. So again, going to your point, I'm not somebody who lacked insurance and needed it.
So basically, they're double counting in a lot of places.
There is double counting, yes.
So we don't really know how many people have actually signed up. There's no way to tell.
We don't know, and I would throw out kind of one last set of statistics, and I know we've been bouncing a lot of numbers around for folks, but here's what I would throw out. There are 258,000 people in Idaho who are uninsured according to Kaiser Family Foundation. We're now 2/3 of the way through the enrollment period for signing up insurance, October 1 to March 31.
Right.
66% of the way through. We have signed up 38,000. That's 15%. So we're 66% of the way through, and we've only signed up 15%. So we've got 258,000 people sitting out there, and only 15% have actually gotten insurance. So that goes to your point.
But it looks like we haven't signed up much more in the federal exchange, if we're counting there, because they're talking about a 1.8 million group.
Yes.
And they were counting on getting 7 million by the end of March.
Right.
That's not a lot of progress.
No, it's not a lot of progress. But it's a lot of money. And it's a lot of money because insurances have had to reconfigure every plan sold in every state of the union. States have had to go through the legislative process, which means there are other things that don't get brought up. You have people who have a great deal of uncertainty being bestowed upon them. You have businesses who are not hiring. These are all costs, you know, and economists look at opportunity costs. If I as a business don't hire somebody, there's a loss. And that person is now not spending money. And that's a loss to somebody else making a product. I mean, this is a ripple effect.
Well, I've heard some economists talk about Obamacare could actually crater this economy. I mean, it could take us back to the 2009 days and 8 days when we go back into another recession. And I think that's a concern for everybody because we never really came out of the other recession.
That's right. I mean, you've talked in the past, and the viewers may or may not know this, but you've talked extensively, Bob, about how stagnant income is over time, especially coming out of this recovery versus, say, other recoveries historically.
Well, I mean, you got a labor participation rate of 68%, which has to go back to 1978 to find those numbers.
Yeah, that's pretty
And
bad.
if you're going down to those numbers, you certainly don't have a growing economy, and you do not have a growing GDP.
That's right.
So the money is coming from the large corporations who are sending their money overseas along with the jobs.
Right.
And we get to pay for everybody's health care around the whole place in our own city here and in our country. I'm just amiss at this whole thing. I just don't get it.
Yeah, and I would just say the problem is we are going down the road. Well, we are a certain amount of space down the road. Having said that, we're also in the position where we can still turn this around. You know, utilizing 3 Supreme Court decisions, including the Obamacare decision, including NFIB versus Sebelius, because this is a federal program, and you know, viewers might not remember, but you know, the state of Idaho, along with every other state in the union, was supposed to implement something called Real ID, which meant that every driver's license had to conform to certain federal rules, just like our insurance products have to, and send that information over to the federal government, to Homeland Security, which would monitor that. That was a federal law passed by Congress, a federal program, and yet no state in the union did it, and we see no action. So there's a perfect example of you have 2 different federal laws. One, are both putting in a federal program. One, the state said we're not going to do that, and we're going to rely upon 3 Supreme Court decisions. And the other one, the Affordable Care Act, somehow we're just doing it.
Well, I guess that comes back to the saying that Justice Roberts made, and that's your states and you're sovereign, and you have to sometimes stand up for it.
Yes.
And it doesn't look like we here in Idaho are standing up for very much.
That's right, and you know, I could just add one little add-on, and that is you have states with different numbers of waiting periods. 3-day waiting periods, no waiting periods, 10-day waiting periods. Every state makes that decision, even though the Brady Bill, another federal law that put a program in, said everybody had to have a certain minimum waiting period.
See, now I understand also that we're having problems with some people who have MS or lupus because these drugs aren't covered under the Obamacare package because they can only use generic drugs. And I've got a good friend of mine who also is involved in this. She has MS. What's going to happen when she can't afford to buy her medication?
That's right. She's going to suffer, and I hate to say it that way, but unless they carve out amendments, or unless the state of Idaho steps back and says this federal program we will no longer comply with, people are going to suffer.
Well, that doesn't make a lot of sense to me, and I'm sure it doesn't make a lot of sense to the people who are suffering from these diseases.
That's right.
I had a good friend of mine who had rheumatoid arthritis, and they told him he couldn't use his drug anymore. He had to go back to a generic. And for 3 months he suffered until he actually found a way to get that drug.
Really?
So I don't see where this will